Why is long-term follow-up important for Wilms tumor? Imagine beating cancer and feeling like you are finally free, only to realize that some health issues might still be lurking quietly in the background. That's why long-term follow-up is so vital for children who have had Wilms tumor, the most common kidney cancer in kids. Even though modern treatments have high success rates, survivors face risks of health problems that can show up months, years, or even decades later. Regular check-ins with healthcare providers help catch these issues early and keep them under control. Wilms tumor treatment usually involves surgery to remove part or all of the affected kidney, sometimes combined with chemotherapy and, less often today, radiation therapy. While these treatments save lives, they can also affect the body in ways that aren't immediately obvious. For example, removing part of a kidney means the remaining kidney has to work harder to filter blood. Over time, this can lead to a gradual decline in kidney function. Chemotherapy drugs, especially those that can affect the heart, might cause heart problems later on. Radiation therapy, although less common now, can increase the risk of secondary cancers and other health issues. Because of these potential effects, ongoing monitoring is essential. Since Wilms tumor begins in the kidney, protecting kidney health is a top priority during follow-up care. Even after successful treatment, the remaining kidney tissue must do its job, which can sometimes lead to high blood pressure or, in rare cases, kidney failure. Doctors regularly check kidney function through blood tests and urine analysis. These tests help identify early signs of trouble so that interventions can be made before serious damage occurs. The risk of developing these problems increases as time goes on, making lifelong follow-up necessary. But kidney health isn't the only concern. Survivors are also at higher risk for heart disease, especially if they received certain chemotherapy drugs like doxorubicin. Lung problems can develop if the cancer spread to the lungs or if radiation was used near the chest. Some children might experience issues with growth, such as weaker bones or muscles, especially if treatment affected their development. There is also a small but real chance of developing a second cancer later in life, which is why regular screenings are so important. Follow-up care isn't just about physical health. It also plays a big role in emotional and social well-being. Survivors might face challenges with school, work, or feelings of anxiety and depression. Regular visits with healthcare providers can help identify these issues early and provide support or counseling when needed. This comprehensive approach helps survivors lead healthier, happier lives. After treatment ends, follow-up visits usually happen every few months at first. These visits include physical exams, imaging tests like ultrasounds or scans, and lab work. The schedule depends on the original tumor size, location, and the treatments used. If any new symptoms appear, it's important to report them promptly. Early detection of problems often leads to better outcomes and less invasive treatment options. The reason lifelong monitoring is so important is that some health issues may only become clear many years after treatment. For example, reduced kidney function might not show up until decades later. Regular checkups allow doctors to catch these problems early, when they are easier to manage. This ongoing care provides peace of mind for survivors and their families, knowing that experts are watching out for their health. In the end, long-term follow-up after Wilms tumor is about more than just medical checkups. It's a partnership between survivors, their families, and healthcare teams dedicated to ensuring a healthy future. By staying connected to medical professionals who understand the unique needs of Wilms tumor survivors, individuals can receive personalized care that supports their physical health and emotional well-being. Remember, always consult your healthcare provider for advice tailored to your specific situation. Regular follow-up is key to living a long, healthy life after Wilms tumor, helping survivors thrive well into adulthood.